Hi, my name is Brian Kim, Professor and Vice Chair of Research in Dermatology, Director of the Mark Lovell Center for Neuroinflammation and Sensation at Icahn School of Medicine at Mount Sinai. In Vignette 5, I'll be talking about itch and AD, inflammation, and a dysfunctional skin barrier. Atopic dermatitis, or AD, is a systemic inflammatory skin disease characterized by intense chronic itch and recurrent eczematous lesions. Patients with AD describe itch as the most common and bothersome symptom of the disease. In the previous video, we reviewed some of the key components of itch, focusing on the signaling pathways that facilitate it. In this video, we'll learn how these pathways are connected to inflammation in AD and the mediators responsible for generating its associated itch. AD is driven by an interplay of type 2 inflammation and skin barrier dysfunction, but several pathophysiological elements may contribute to its associated itch. Type 2 inflammation, which is present in both lesional and non-lesional AD skin, can be driven by exogenous triggers or from endogenous immune factors. Specifically, cytokines such as IL-4 and IL-13 directly drive barrier dysfunction and contribute to lesion development and itch. On a local level, barrier dysfunction, which is worsened by scratching, triggers keratinocytes to produce and release pruritogens and itch mediators, including alarmins like TSLP and IL-33, as well as periostin and kallikreins. These factors then amplify or exacerbate the inflammatory type 2 response by activating other stromal and immune cells, thereby perpetuating the itch-scratch cycle. Pruritogens may also promote the release of neuropeptides like substance P and CGRP, which contribute to vascular dilation and the subsequent recruitment of additional immune cells and their inflammatory mediators to the skin. Among adaptive immune cells, Th2 cells play a particularly important systemic role in AD by releasing several key cytokines, including IL-4, IL-13, and IL-31. IL-4 and IL-13 signaling enhances itch both by inducing the production of itch mediator KLK7 in the epidermis and by sensitizing sensory neurons to pruritogens such as IL-31. IL-31 was the first cytokine identified as a pruritogen and is produced by activated Th2 cells and other cells. Given that IL-4 drives differentiation of Th0 cells to Th2 cells, IL-4 influences the levels of IL-31 in the skin. In fact, IL-31's receptor subunit, IL-31 receptor alpha, is upregulated by IL-4 stimulation, linking these two cytokines together as major pruritogenic components of AD in the adaptive immune system. You may recall from the previous video that multiple pruritic pathways are dependent on different types of signaling mediators. The nerves that transmit itch in patients with AD are primarily, though not exclusively, sensitive to non-histaminergic or histamine-independent itch pathway activation, which tends to underlie chronic itch. Chronic itch isn't the whole story in AD. The majority of patients with AD express high levels of antigen-specific IgE produced by B cells. How does this happen? Early exposure to antigens results in Th2 cells that activate B cells to produce specific IgE. The presence of allergen-specific IgE may be associated with acute itch in patients with AD. Accordingly, patients with AD who have allergen-specific IgE tend to exhibit acute itch at a higher rate than those without allergen-specific IgE. During an allergic response, IL-4 and to a lesser extent IL-13 enhance B cell production of IgE, which activates innate granulocytes like basophils and mast cells. The cross-linking of IgE bound to these cells primes them to release cytokines that contribute to chronic itch, but also release other inflammatory mediators like leukotrienes, such as LTC4, which bind to the cis-LTR2 receptors found on neurons and initiates acute itch. IgE is unique in that it is the main link between the adaptive immune system and the innate immune system in the setting of allergic responses. In summary, itch in AD is attributed to multiple cellular and molecular mechanisms with a major initial contribution from epidermal barrier dysfunction. Subsequent scratching results in epidermal damage due to excoriation and epidermal barrier thickening, perpetuating inflammation and sensitization to itch. In the following 2 videos, we'll learn about the overlapping and unique mechanisms that drive itch in prurigo nodularis and chronic spontaneous urticaria.